Hello, my name is Robert Giuliano, and I am editor-in-chief of the new Anticoagulation Management Clinical Community, which is available on CardioSource. Today I'm talking with Professor Asen Gudev from Bulgaria on the topic of novel anticoagulants. Welcome, Professor Gudev.
Hello.
Hi.
Hello from Sofia, Bulgaria.
With regard to oral anticoagulants, could you share with us a little bit about the use of the oral anticoagulants historically in Bulgaria and then also in Europe? And what do you see as, the challenges of the standard oral anticoagulants?
In my country, like in many other European countries, the most frequently used oral anticoagulant is acinocomarol. In many Eastern European countries, we use little warfarin. Actually, in Bulgaria, warfarin is almost unknown. I don't know what is the reason for that. But anyway, acinocomarol is a well-known drug. And the main indication for prescribing acinocomarol, like in many other countries, is atrial fibrillation. Bulgarian population is about 7 million now, and we estimate that we have about 7,000 to 100,000 patients with atrial fibrillation. Of them, only 40% are treated with the oral anticoagulants, and that is a percentage which is lower than the average number in Euroheart survey, where the percentage of patients treated with oral anticoagulants with atrial fibrillation was about 70%. And there are several reasons for that. The main reason is physician neglect. I think that many doctors underestimate the risk of thromboembolism in patients with atrial fibrillation, especially in patients with paroxysmal atrial fibrillation. They don't understand that the doctors neglect this problem, and they prescribe rare oral anticoagulants in patients with paroxysmal atrial fibrillation. That is one of the challenges. Unfortunately, we don't have enough anticoagulation clinics, and the quality of the control of the INR is about 40% of the treated patients are in their therapeutic range. Most of the patients are with INR below 2. So they are practically not protected from risk of thromboembolism. That is similar to the other countries, neighboring countries like Turkey. They publish their registry. We have also some registry data which shows that actually there is an unmet need to improve the rate and quality of anticoagulation with the classical anticoagulants.
It sounds like in Bulgaria and many of the neighboring countries, then the novel oral anticoagulants would be an important advance because they don't require any monitoring, which seems to be a big challenge in your region of the world. What do you think of these novel oral anticoagulants, and have you had some experience with them?
We did. We have on the market since 1 year dabigatran, and since the beginning of the year we have also rivaroxaban. Actually, in Relay trial, it was shown that the centers with poor INR control, the advantage of the new anticoagulants is greater. Of course, I think it's very important to educate physicians and patients how to be compliant with the new drugs. New drugs look very promising in many regards. Predictable effect, fewer drug and food interactions, but also there is important issues that the patient adherence is very important. We have to educate much more patients how to improve their compliance. I think that one of the problems that some of the new drugs are prescribed twice per day, which is a problem especially in this elderly population, I will say fragile population. especially when you have advanced age or patients after stroke. I think it's very important to educate physicians that monitoring of renal function, of liver function is very important, and to educate also patients and doctors how to follow for adverse effects like bleeding, potential bleeding, minor or major bleeding. So I think it's the situation looks promising, but you have a lot of work to do in order to apply the advantages of new drugs in full.
Well, thank you so much, Professor Gudev, for your insights into the novel anticoagulants. And thank you, audience, for your attention today. I hope you will visit the community frequently for ongoing information about anticoagulation management. This is
Thank
Robert
you.
Giuliano for the CardioSource Clinical Community on Anticoagulation Management.